So let me kick it off. I'm Jerry Hafer with the AMAC Foundation. AMAC, for those of you that are not familiar, AMAC is the Association of Mature American Citizens. We are the largest and fastest growing conservative alternative, spokes organization, I would say, for conservatives in America. We are rapidly growing. We are about getting close to 2.5 million members. Still relatively new. We've been an organization since 2007, or AMAC has, and has been growing extremely rapidly in the past couple of weeks. So, again, we are the conservative voice for America's seniors. The AMAC Foundation, the organization that we represent here, is the public benefit corporation affiliated with AMAC, but separate from AMAC. We are a 501c3 registered nonprofit in the state of Florida. And our mission is a simple one. It is to provide, to support and educate America's seniors. That's our very simple mission. And we do it in a number of ways. One of the ways is conducting public seminars on topics that are of interest to seniors, as is today's. We also do a number of publications on issues relative to seniors. And we also provide a very active Social Security advisory service where we provide accredited response to questions that people have about Social Security. We have 6 trained and accredited advisors that handle inquiries, and we handle quite a few inquiries, an average of over 500 a month, of people that are grappling with trying to understand Social Security or aging in and have no place to go really for credible answers. So we provide that service. That's a quick recap of AMAC and the AMAC Foundation. You can check our websites if you need more information. amac.us is the primary AMAC website, and amacfoundation.org is the primary foundation website. So check us out and you'll see on there a wealth of information about what we do in support of America's seniors. So, as I said, our seminar series is one of the ways that we support and educate America's seniors. And today, we have a topic that is extremely important to America's seniors. I know it's important to me, and I'll probably make some comments about that as we go along here. But the topic is very simply heart health. And I'm pleased to have with us today Gloria Puerto Ibi from Vitas, and who's helped us set this presentation up, and also Dr. Alejandro Vittoria, and I'll say a little bit more about him in a moment. But first of all, about Vitas. For those of you that are not familiar with Vitas, Vitas has more than 40 years of experience in hospice care, and actually it's the nation's largest single source provider of end-of-life care. Magnificent organization. We worked with them on a number of projects like this, and I really appreciate the relationship that we have with them. There are nearly 12,000 Vitas professionals that provide care to nearly 20,000 patients daily in 14 states in this country and the District of Columbia. So it's a very, very large organization, very well-respected organization. But in addition, there are 4,800 trained Vitas volunteers who annually provide hundreds of thousands of hours of service in support of again, America's seniors. Gloria is a Columbia native. She's a community educator for Lake and Sumter counties. That's her primary role. And as I said, we've worked with Vitas and Gloria now for quite some time, and we just have a tremendous relationship. We find her very enjoyable and very intelligent. We appreciate the relationship that we have with them. Dr. Vittoria is from Aegis Medical Group, and he has over 30 years of experience as a family physician, working with multiple patients with cardiovascular diseases. And today he's going to be presenting the clinical side of the seminar, and he's going to be complementing some of the things that Gloria will be saying about heart health in general. So with that, I'd like to kick the presentation over to Gloria. I'm going to make her host for the time being, and she will take over. Okay, you should be good to go now, Gloria.
Thank you so much and good morning, everybody. I'm Gloria Evie. Thank you for that kind words, Jerry. I love you guys so much too. I enjoyed this seminars. It's so important to bring education and to bring the best. And that's why we decide, and we are very fortunate to have Dr. Alejandro Victoria. I know, Doctor, your time is very valuable. So I don't know if you want to start the presentation and then I can finish, because I really appreciate your time. I don't want to take it out of your patients right now. So Doctor, very proud of your work in the community in Florida, in Claremont. So do you want to start?
I will, and thank you for your opportunity once again. Basically, the topic today is kind of broad topic. It was cardiovascular disease and prevention, basically, would be the main focus this morning.
Yes, sir.
As probably the community and the medical community as well knows, cardiovascular disease is the leading cause of death for males and females between the age of 45 and 79 and probably over. It's still ongoing problem. The medical society have created a lot of guidelines. As me as a practicing physician, it's difficult to accomplish all that unless you have a good communication with your patients. Awareness, education, seminars like this one will probably help a lot to continue preventing and avoiding death from this disease. And cardiovascular basically means focuses the heart, your brain, your kidneys, and as a whole, the body as a whole. And that entitles a lot of care, a lot of focus on your health as a human being, and also as a doctor to guide you or to prevent, to identify possible potential deadly disease as this one is. There's many risk factors that have been identified with this, including diabetes as a major problem, obesity, hypertension. And then there's some factors or risk factors that you can modify, especially smoking. It's a major problem, probably one of the worst um, risk factors that you can have as a patient or as a human being, male, female, it doesn't matter. It can affect your body in many different ways. And it actually starts from the beginning. Let's say if you smoke for a few months, maybe you have a less chances of developing side effects related with the nicotine and all the products that's involved in a cigarette. But then as your time goes and you smoke for many years, the risk factors increases. Even if you stop after 10 years, you still have like 50% of developing cancer as a worst case scenario, or any other disease related to it per se, including a stroke, heart attacks, kidney failure, and including that with diabetes and then adding on the cholesterol issues. That would be three major factors to develop, once again, from stroke, heart attack, kidney failure leading into renal failure, hemodialysis. Those three may be one of the major reasons for people going into dialysis in the Western hemisphere. But at least you have chances of modifying those risk factors. Lifestyle modification to begin with, healthy life, healthy diet, stopping smoking, exercising regularly, being seen by your doctor in a timely fashion at least once a year, depending on what medical problems you may have. And then comes the medication part of it, if it needs to be done, needs to be added to your regimen if you're not accomplishing what is expected to. Let's say a blood pressure less than 130/80, or your cholesterol, total cholesterol less than 200, your HDL, that's supposed to be the good cholesterol, more than 50, depending whether you're male or female. There are some tables that will guide you on that or to guide us as doctors. and emphasis on good sleep, moderate alcohol intake. And I want to make emphasis on this part here. There had been research trial that state that if you drink a little bit of alcohol, moderate, maybe 1 or 2 drinks for a male, maybe 1 drink for a female, it's very beneficial according with the data. And that probably be better off if you drink red wine. There's good seeds on the wine, on the red wine, and it's been proven that can help with your cholesterol and your vessels, per se, the arteries and the veins, to keep them well functioned. But more emphasis, once again, healthy lifestyle, good diet, exercise regularly, losing weight. A BMI more than 27, 28 is already a risk factor. So if you don't pay attention and then just sit on the couch pretty much every day watching TV, not doing too much activity, nowadays playing games, it's a problem. Now I can see it at young ages, people are overweight already, any problems. And then there's a major problem that you cannot change, genetics. If you come predetermined with some genes that will affect your lifestyle, your life per se, your development as a human being, it's a problem. Now, going to a doctor on a regular basis, you can probably be able to identify that working with your provider. And that will give you probably a better chances of a better life and a long life, long lasting life, quality. If there's no medical treatment and then you have an option of a surgical treatment because you have developed CAD, coronary artery disease, that's a major problem, you probably will have a chance before an event happens, whether it's cardiovascular event or cerebrovascular accident. That nowadays is very sad to have one of your relative with paralysis, not able to speak, not able to eat. If they're lucky enough, they'll still survive a major event. Or once again, the doctor will tell you that you need to start dialysis because your kidneys are no longer working. Because you didn't pay attention to the diabetes, your cholesterol problem, your blood pressure problems, your obesity. There's many things that you can check when you go to your doctor's office as far as your blood pressure. Keep monitoring your pulses, make sure that they're regular, equal. Any changes with your vision, if you're a diabetic person, after a year or 5 years of being told that you're diabetic type 2, you should be able to get a regular checkup at least once a year. Controlling your diabetes is important. It's a major issue with. And then there's parameters that you can check or your doctor can monitor. Let's say your hemoglobin A1C is a test that can be done every 3 months or every 4 months if you're stable enough to allow that to happen. And you want to keep that number between 6.5, maybe less than 7 if you're a diabetic with a decent controlled disease management. Also checking your cholesterol, make sure that your HDL is in a good range, your total cholesterol is less than 200. And the LDL actually is one of the worst cholesterol. It's been a kind of issue whether it's less than 100 or less than 70, but the less possible number on that is best. There's many research, many trials that's been showing good data on that, controlling the LDL and your cholesterol percent. But once again, the human being is a body. So you need to coordinate pretty much everything in order to accomplish. You cannot think, okay, I have a good vision, now I have glasses. Or you cannot breathe because you're smoking pack daily for 20, 25 years. Then you needed oxygen at some point, or maybe be considered to have transplant of lungs if you're lucky enough. And then comes the worst. You were diagnosed with a cancer. And maybe it's too late now, it's stage 3 or stage 4. you have not too many chances of surviving or getting proper treatment if it's because it's too late. And that can be devastated. So I can probably talk more about detail, but if you have any questions or the audience at some point will have any questions.
Can I ask a question, Doctor?
Yes, sir.
Have you fielded any questions about the relationship between COVID-19 and heart disease? Does COVID-19 contribute to heart disease in any way?
Well, this is something ongoing, no? COVID-19 is something new. And many side effects or lingering problems coming after, related with, especially if you have predisposing problems, diabetes, obesity, COPD, asthma, and on that matter, cardiovascular problems. I believe if you're healthy and all, you probably won't have no issues related with that. So as the time goes by and people doing research and studying those populations that's been affected with the COVID and the one that has survived, of course, I mean, following with echocardiograms, if it had been admitted to the hospital, probably initially they would probably get an echocardiogram depending on how bad their disease has been. And those patients, I'm pretty sure, will follow up with their cardiologist or PCP, and there'll be more testing done on that regard if they have developed or be getting worse symptoms related with cardiovascular problems. I understand that I have seen some patients in my office here that they have developed pulmonary fibrosis. But once again, those patients already had some problems, COPD or pulmonary interstitial disease to begin with, or heavy smokers for many years. Whether the COVID has contributed, COVID is very unique. I mean, you have developed or can develop a lot of inflammation, and the immune system per se can destroy your body. And that's probably one of the worst scenario with the COVID, that it attacks your immune system, and if you're not able to fight it out, you probably have a very slight chance of going the other direction or stay alive with many complications related to it, whether you become oxygen dependent for at least 3 months or 5 months, it depends. Once again, if you have underlying condition, probably be a little bit more challenging. But now, hopefully with the vaccine, people will have more chances. And once again, it's a new topic in medicine. Time also will allow us to have more data and research and information. And I'm pretty sure it'll be professors and people with expertise on this that will come with some information and ideas and guidance how to make it better for the world in general. It's actually everywhere. So let's regard that this year will be a little better now with the people being vaccinated and hopefully being continue with the prevention, mask use, distancing, and taking all the precautions necessary to avoid.
Yeah, I personally am following all the precautions. I have a unique situation, somewhat unique situation, that I'm recovering from a bout with endocarditis that led to replacement of a heart valve about 1.5 years ago. So I'm very concerned about the potential. I'm midway through the vaccination process. I got shot 1 and I'm going to have shot 2 in 2 weeks. So that's kind of a personal perspective on it, but I worry about it.
Well, hopefully you'll be okay now that you have the vaccine and continue doing what you need to do as far as preventing problems. Don't take any chances.
No, I don't.
Doctor, have you seen a lot of younger people in your practice with heart disease? Do you feel that it's becoming more prevalent with younger? I mean, at one age, you say between 47 and 75, but are you seeing more younger patients than that have developed cardiovascular disease?
Not to be honest. I mean, once again, unless you're genetic predisposed and have a lot of, because no paying attention to nothing, you're obese already, and you can, your BMI is 42, 45. It's a problem to begin with. And then your family history is an issue. Your mothers and parents are diabetic. You're not paying attention. You're eating like there's no tomorrow, drinking Cokes and sodas and having a large meal from whatever of those chains there. It's a problem. I mean, if you can prevent, you can do better. Well, hopefully, no, I haven't seen that many young people with cardiovascular disease, but they can early now. Diabetes is a problem, hypertension is a problem, plus or minus cholesterol. If you add to that, it's a matter of time to develop cardiovascular problems.
And sometimes, doctor, just a quick question. In young people, it's just like usually it's a heart attack, not like they don't have any like anything happen before. It's just like get a heart attack and just get it, right, without non-announcements. Or do you think people get an announce, like feel the body having issues and do not pay attention, and that's why you see more young people probably with heart attacks?
Okay, well, on that matter, medicine has been done like this. You have acute problems, you have maybe chronic problems, or subacute problems. History is important. Cases, scenarios, let's say young people, if you pay attention, maybe it's related with drugs, illicit drug use, and there's a major issue with that. I know because I work as a hospitalist and I see young people overdosing, come with heart attacks because of cocaine use, amphetamines. It's a problem. That's a different story. That's a different population. Now, if you once again genetically being predisposed with, and you were born with some heart problems, nowadays actually you see young people with congenital heart disease that they have successful surgeries, and now they have a long life. So once again, that's also a different population.
Yeah.
If you get a patient like that, you get a good history, then you pay more attention, because maybe at some point they can develop problems early in the life because of underlying condition that they had. But once again, medicine's amazing. Cardiovascular surgeons, they have done tremendous work and doing and continue developing devices, more technology to prevent like that. And like Mr. Gerald was saying, endocarditis used to be a major problem before, but nowadays it's better. There's no much prophylaxis used because they have determined who are those patients that need prophylaxis because they had endocarditis in the past for X or Y reason. Now they have kind of cleaned that up population and not that many heart problems in the past. Pretty much everybody will need antibiotic prophylaxis. Now maybe one or two conditions will require it. Or if you have a device that's been put because of orthopedic surgery that may require it for you to have it in order to prevent infection of those replacement, hips, knees, shoulders. It's different. But once again, if you as a clinician take your time and take a good history and define your population and work diligently with your patients on changing those that you can change, meaning weight, your diabetes, your cholesterol, your blood pressure, make sure that you put emphasis on lifestyle modification, more exercise, drinking enough water, avoiding salt, many things that you can, if you listen, and I know, if people do half of what I'm telling them, they'll be okay. They'll never be in the hospital to begin with. And lucky enough, if they take half of their medications, they'll also be better off. And presentations like this, I believe it's helpful. People now have more tools to communicate, to look, and hopefully getting into the internet, like using WebMD site, let's say for information, is better than Google, whatever. because there's so many information there that can be misleading. And that's, I'm sorry, that's a problem, in my opinion.
That's very good. Thank you, doctor. And we're going to put your phone number of your office. That is okay. So people that have more questions or want to contact you, so they can call your office. So we will definitely leave that in the slide at the end of the presentation, so you can,
Yes.
so you know when you start receiving a multiple calls about.
That's great. I'm happy to be here. I'm happy to have given the opportunity to participate. And thank you once again.
Thank you so much, doctor. And if you need to step up and see your patient, you're more than welcome. I'm going to continue with information about cardiovascular disease. But when you're a caregiver, right? When you take care of others, you need to take care of yourself. So let's start with that presentation. So doctor, thank you so much. You're more than welcome to keep going with your patients, because I know you are very busy.
Yeah, let me say on behalf of AMAC Foundation, doctor, we really appreciate your time.
It is so amazing when you you probably have this education and see how the doctor was saying, sometimes you know what you have to do. Sometimes you just need to keep yourself keep up with your doctor's appointments, with everything that you need to do in order to have the best quality of life. And he talked about quality of life. But sometimes when we are taking care of others, and the nature of our business and the nature of our industry, working with families and patients that are in a terminal ill conditions, sometimes it's really sad to say, but the caregivers, the person that is taking care of that patient, pass first than the patient that is ill, because we forget about us when we are taking care of others. And that's why I want to end this presentation, this seminar, with a little bit of tips of what you need to pay attention to. And this heart disease prevention for caregivers is important because we want to raising awareness of heart disease. So you as a caregiver, or if you know someone, or just pass the information, because you need to live healthier and long life, especially if you're taking care of others. So this month, February, is the Heart Awareness Month, but we partner with the American Heart Association, and we work close to raise awareness for heart disease in caregivers. So as a caregivers, you spend a lot of time caring for those around you, but sometimes you ignore what is going on with yourself. So when you compromise your health, you compromise the care that you provide to those that you is around. So it's time to take care, and it's time to start and take control. So knowledge is power. That's why we'll bring Dr. Alejandro. So if you understand your family history, if you know what is going on, if your mom, your dad, your grandparents all have heart disease, it's very, very probably that you have as well that risk in your lifestyle. So lifestyle choices play a major role in the heart disease prevention. We hear the doctor talking about that. So make sure you manage your stress level. And this is very important. People do not get it. As the more level of stress you have, your brain, your entire body suffer a lot about it. And this is studies. Actually, I was reading studies from Harvard University that when they have like the measurement in your brain, how that affect and how they can start develop a lot of problem in your cardiovascular disease, accumulate plaques of fat in your arteries, creating a lot of issues. So when you manage stress, when you develop better eating habits, and you exercise at least 20 minutes, you definitely will start a good journey, because you're not alone in this. You have AMAC, AMAC family. So they are providing all these tools. So let's see here, just a few steps. I'm gonna just give you 3 steps. So first, you know your risk, and we talk about that. But what we need to take care of it, right? Your family history, this is important. Your genetics. African Americans are in high risk of high blood pressure, stroke, and diabetes. Hispanic Latinos are more likely to suffer from high blood pressure and high cholesterol. And that means our way to eat in our culture. So depends of how you and the genetics are there. This is 2 genetics that are very important to have. Age. Females over 55 who have reached menopause have an increase in certain risk factors, like increase in blood pressure, increase in LDL or bad cholesterol, and weight gain. I'm telling you, I'm 45 and I'm start feeling it. So sometimes we don't take care of ourselves. That is important to have. Family history, genetics, and age, very important. Now, when we talk about caregivers, I want you to show you right here a little bit about who are they, right? When we talk about caregivers, 72% are Caucasian, 13 African American, 12 Hispanic, 2% Asian American. Now, 67% of the caregivers are females. So ladies, we need to understand that if 67% of the caregivers are females, that means that we have most of the jobs or most in the family care when have to be to take care of others, which means if we don't take care of ourselves, 67% of those people that are caring for are in a high risk to lose you before they go. So that is very important. You know, how to prevent that heart disease, stress management. And I have some points there. First of all, don't let stress manage you. So learn to forgive. That is very important. Sometimes we carry so much anger and so much frustration, and we have that hard time trying to just thinking what other people do to me, and oh my gosh, this situation is so wrong. And we need to let it go and forgive, because that stress, that you are eating that, your body is suffering, nobody else. Do you think that girl that took your boy is gonna suffer? No, they're happy. Now you have to let it go and live your life, because at the end of the story, you're the one who control it. Look for the positive. We talk a lot about this in self-care in the past webinar, but see how everything connected is incredible. So practice deep breathing, share your feeling with a friend and support group. We have a wonderful support groups. If you go to our page, btas.com, you will find a lot of good support groups for if you are dealing with any grief or bereavement. Healthy eating habits. And this is a good question. Sometimes we try to follow diets that we find in the internet, or someone tell you, no, the keto diet is the best, it's high in fat, and oh my gosh, no, the low carbs is the best, no, the high protein is the best. But actually, I highly recommend to go to your healthcare provider, look for a dietitian, registered dietitian, and go through that and see what is the best for you. Everybody is totally different. If you're taking medication like blood thinners and or medications that sometimes you cannot eat certain things, so you need to go to your provider and make sure that the diet that you decide to go through is the best for you. Something that is not necessary that you go to the doctor or the dietitian to know is cut portions. The portion, instead to eat like 16 ounces, right, ribeye, you just can't get, right? Yeah, I'm telling you, 16 ounces. So you just cut that. Usually it has to be like 4 ounces or less, but not 16, right? So it is just be mindful when the way that you eat is not that you're just gonna eat grass and water like someone say once to me. Well, oh, you just want me to eat grass and water? No, you can eat, but then the portions are important. You know, instead of French fries, you can order a salad or avoid just sugary drinks like sodas. And some people, no, I drink Diet Coke. Sometimes I prefer people to drink the regular Coke than the Diet Coke, because what they put in that Diet Coke is worse than if you're drinking the, but to be honest, just eliminate it. Try to eliminate that sodas. Drink more water. Water is extremely important. Exercise 20 minutes. Go, you know, Jerry, we're like in a golf heaven, right? Everybody do some golfing and have a lot of golf, right?
Well, my problem with golf, Gloria, is that takes me over to the first column on stress management.
True.
True enough. So really what we need to do right here is just like do something, and thank you for bringing back that. If you're doing something that generates stress, don't do it, because right?
That's why I don't play golf anymore. I very infrequently. I look at it more as a social engagement these days.
Yeah. If you try to look at like
I saw a slogan not too long ago relative to exercise that I think really put it in perspective, that sitting is the new smoking.
Yes. Especially in front of the TV when you have Netflix and all this series that do not stop and you have to wait until the next week. No, you actually can have all the seasons in just one sitting. It is true.
It's a problem. It's a problem these days with the electronics that we have. You don't even need to get out of your recliner to change the channels. And you know, I'm old enough to remember when you had to walk to the TV to change the channel.
Me too. Me too. I have to, actually, I was the control remote for my grandmother. She was like, go walk and change it.
Change the channel.
Change the channel. Yeah.
I think exercise is so much the key to good health, frankly.
It is. And it's a lot of good exercising. I do something called Tai Chi. And Tai Chi is a really slow movement. So wonderful for your balance and for your mind and your body, your spirit. I think one of the, I get in love with the Tai Chi because it's really, really a good way for non-impact exercise that anybody can do that actually support your brain and cognitive. So I think that I can suggest a lot of, if you can find some place where you can practice Tai Chi, and you can go online and you can see the Tai Chi as well. YouTube have wonderful videos for beginnings that you can actually see. And the third is, well, why you need to be healthy, right? Why? It's our family, it's the people that we love. Because you know what? No one cares for your loved one the way that you do. If you're taking care of others that you love, you need to understand that only you will do what you do. The kids are getting married this year, right? And they grow, they go, but they always gonna have that memories of your care, of the care that you give it to them. And you know what? You will feel proud that you do what you need to do to share with them the new time, the new the new things that they are doing and enjoy it in the quality of life. You deserve to be healthy. You deserve to be healthy. Love yourself. Self-care is important. And you have some reference there that we work with American Heart Association. We have something called National Wear Red. It is the first Friday of February. And it's extremely fun. See everybody, you know, dressing in red for support. And that is really good. So you can see here some reference where we take this and how you can do it. This is information of Dr. Alejandro Victoria and his other doctor in his practice, Dr. Yadira Perez Vélez. Both are available. That's the information. That's whatever information you need there, the address and the insurance and all the good things. They are very, very nice people, very knowledgeable, and it's really good when you hear you know, someone to talk about prevention, to do not wait for being sick. So this is something that is very important. I really enjoy doctor's presentation. And this is our information. If you need anything included this presentation, just you can ask Jerry, or you can actually send us an email, and we're more than happy to send it to you. But go back
Excellent.
to you.
Excellent. Well, we appreciate that, Gloria. And once again, we appreciate your time and your talents. It's always a pleasure to work with you and Christopher. And today, I think we had the benefit of Dr. Victoria. That was a tremendous addition to the program. He was very interesting to listen to. So
thank you so much. I really appreciate, and I wish you the best. See you next time.
Thank you.
Thank you.
Look forward to working with you again.